Hello, and welcome to another episode of Men's Health in My Perspective. I'm your host, Larry Hamilton. Today, I share a recording of my office visit 10 days after surgery. That's when I went in to review the pathology report and then get my catheter removed. This episode will focus on questions I had for the doctor. Earlier that day, I had picked up something and moved a certain direction and thought I popped a stitch, so I had a question about that. And then several other questions. And at the end of the questions, we go over the pathology report. I live in Michigan, so I did not need my doctor's permission to record him. However, I did do the courteous thing and ask for his permission to record this. So I share it with you in hopes that you find it helpful and informative. And as I said, this is 10 days after surgery. And I got a bunch of questions I made note of, but
Sure.
frankly, I was more worried about the catheter than anything.
Yeah.
And the worst part is when it tugs the bladder or rubs into the penis. Other than that, it's not been it's a hassle, but it's not bad.
Okay. Kind of look at your incision real quick.
Yeah.
Which one do you think it popped?
It feels like right here.
Okay.
Now this big black and blue one down here started leaking sometime yesterday, so I had to put a bandage on it. And the drain tube one is still leaking.
Really? Okay.
And so,
Take a look here.
do you want me to untie that?
No, I don't think so. Okay. I don't see anything that looks like they're infected or anything like that, which is good. It doesn't look too bad. I mean, I know it doesn't look great, but yeah, it doesn't look too
this one's
bad.
starting to fade, so it's not as bad as it was.
Yeah. I mean, this all kind of looks normal for this sort of deal, so I just keep doing what you're doing.
Okay.
Just kind of
Dry bandage?
dry bandage and it'll clear up, and eventually maybe just stick a Band-Aid or something like that on there.
Yeah.
So
Well, if this one wasn't an inch long, I could use a Band-Aid,
right, yeah, I know. Okay, you can.
And this one, I can't really see it. I gotta, I have to look in the mirror to do both of them.
Yeah,
I
yeah.
can't
Okay,
see it.
we'll get this thing out of there. Okay.
Yeah, yeah.
But yeah, what kind of questions do you have for me?
Okay. So there's 5 incisions?
Six.
6.
So
Okay.
1, 2, 3, 4, 5, 6.
Okay.
Yep.
And then, just out of curiosity, how many internal stitches?
So we put one around the big vein that's above the urethra, and
Okay.
then so that's one, and then the only other ones that's in there are the ones that sew the bladder back to the urethra. Those are kind of 2 stitches together.
Okay. So does it look like I popped a stitch, or?
I don't think so. I mean, it looks like it's just sort of healing. I don't see anything that's like obvious bulging out here.
Okay.
I mean, that hardness, that's suture under the skin. So,
Okay.
and
But it feels like it's right here. This is where it hurts. So maybe I just tugged at it or something.
might be, so
Okay.
generally the right side is more painful than any of the other ones.
Is this where it
because we
came
put
out?
No, so it comes out here.
Okay.
And we use stitches, well, I guess, so there's a stitch down deep here to close the abdominal wall, and then there's a stitch deep in there because there's a bigger site. And so generally people have pain on that right side more than any side.
Yeah, it's been a little more tender there. Okay.
So it should get better though.
So then you don't think I popped one? Well, that's good.
I don't think so.
So exactly how long did my surgery take?
About 3 hours, 3.5, something like that.
Okay,
all in.
just not too bad. Okay.
Not terrible.
Okay.
Just took a little longer.
All right. And then did any of my bladder sphincter muscles survive?
Yeah, I think so. So there's always one sphincter muscle that goes with the prostate because it's like sort of it's like attached to it basically. But as far as the external sphincter that we have you learn those exercises for, I was able to spare those.
Oh,
so,
okay.
Once the catheter comes out, you can start doing those exercises.
Right.
Start to work on that, but you may have some issues like right afterwards, as far as leakage, but then it should get better with time.
Okay. Yeah. Oh, and leakage. I couldn't believe how much I was leaking even with a catheter. It's like, wow.
Around the catheter?
Uh-huh.
Yeah.
I guess that's normal.
It happens just because the bladder sometimes, if it contracts with that catheter in place, it sometimes goes faster around it than it does through it.
Sure. How long can I expect to regain continence?
It can take up to 18 months. Most of the time, by 6 weeks, guys have noticed a significant improvement. Though.
Okay.
Every now and then we get some guys that are completely continent, like right after the catheter comes out, and we're like really surprised to see that. And it's a good surprise, but it's not common. So I would say, it's bad right after this, and then it gets better within the first few weeks. Most of the time, by 6 weeks seems to be the sweet spot for most guys.
Okay, good. And then is it like about the same with sexual function?
That takes longer, so it can take up to 6 months before. I tell guys that the erections take longer for those to come back. Sometimes younger guys like you have, bulletproof nerves, and they, start getting erections back earlier.
Okay.
As far if you magically did have erections, I would just say hold off 4 weeks. I don't generally see that much, but.
Okay.
Yeah.
And then the nurse answered that. I guess we're going to talk about the pathology report.
Oh, yeah.
So that's today. So then we'll get back to that. My granddaughter really wants to sit on my lap. Mm-hmm. So if I just let her climb in and it's not hurting me, is that okay?
Yeah, that's fine.
Okay.
Yeah, just don't lift anything more than like 20 pounds.
No.
Weeks.
After that tweak, I'm like, oh my God, did I pop a stitch? Yeah, it was something else. And then I have been like ridiculously emotional. Is that an anesthesia side effect or just glad to be alive?
Could, I guess, a little bit of both. I mean, I don't know why. I mean, it could be that, but
maybe. Okay. Yeah. Well, I just had existential dread, and as soon as I woke up, by golly, it was cured. So and then I have been seeing a chiropractor, and I want to know when it would be okay to do an adjustment.
Probably I'd wait a month, so 4 to 6 weeks, somewhere in there.
Okay.
Let everything kind of heal, and then if it doesn't hurt when you go to do it, it's probably fine.
Okay, yeah, okay, so that was all those questions. So now pathology.
Yeah, so it was kind of the same stuff that we saw on the biopsy report. The final score was just the Gleason 7, okay? It was all contained in the prostate.
Thank you. Oh my gosh.
Yeah, so it didn't leak outside of the prostate. There was so I'll just mention this. This is really common with the robotic approach. So there was a spot where they saw cancer up to the edge of what I took out, but when we're taking the prostate out and sparing the nerves, we get really close to the prostate. So if I don't give them a clear margin of some normal tissue on the other side of the prostate, then sometimes they'll call them positive margins. It's not clinically significant for a vast majority of patients, meaning that the PSA goes down, and if it stays down, then we don't worry about it. So there was, on one side, they saw a little bit of cancer up to the edge of what I gave them, but I don't really think that that's a clinically significant thing because I didn't see anything in there.
So there is a minuscule chance we got a problem.
Minuscule. I mean, just like any time, even with negative margins, it doesn't mean it's always like the PSA is going to go down to nothing. But basically, so one of a few things can happen. One, your PSA goes down to nothing and just stays there, and we don't ever have to do anything about it. And that's pretty common with this kind of disease because it's not a very super aggressive type of cancer. The other thing is you can have a detectable but low PSA number, and that just stays like that forever. Yeah. We don't treat those either.
Right. Yeah, you said if it's 0 or flatline, and it's what? Over the next year, every quarter get a blood check?
Yeah, so every 3 months we'll get your PSA and see what it does. I'm suspecting it's going to go down to either nothing or like close to nothing, and if it stays there forever, we don't even do anything about that.
Right.
Or if it came back down the road and it kept climbing up, then that's when we talk about radiating the area, but we are not hoping or anticipating that we're going to have to do that.
Good. Okay.
So, anyways, but all confined as far as the Gleason 7 stuff, only about 5% of all the cancer that was in there was the Gleason 7. Otherwise, it was like the Gleason 6 stuff.
And so the 7 is the low side of bad.
Correct. Yeah. So it's a favorable intermediate risk or kind of middle of the road from aggressiveness perspective. Mm-hmm. But most of your stuff is Gleason 6, so that's like the least aggressive.
Good.
So, anyways. All that stuff is, pretty good. Outside of this positive margin, everything looks fine. So, and again, that's not, like I said, uncommon in the robot approach because we get so close to the prostate.
Right.
And if we're trying to spare the nerves, then that's just a known risk factor deal. So. Yeah.
Do you want to get an erection or do you want to be sure?
Right, exactly. So, we can always whack out all the nerves, but then, and get the cancer in there. But especially at the apex, and in your situation, your pelvis and the size of your prostate made it a little bit tricky to get down as far down as I could get to the apex, which is where that was, and that's where they mostly are. But it is all contained in there. So if the prostate cancer is contained, but they see a positive margin, usually that just means I got too close to the prostate when I'm trying to spare the nerves. But most of the time, in other patients that have had this, their PSA goes down and we never do anything about it.
Okay, great.
So,
I know the other couple questions. I'm probably not the largest prostate you've ever seen.
Not the largest, no. I mean, it's sort of middle of the road, I guess, as far as size.
But you were surprised that it was twice the size you thought it was.
Yeah, exactly. So sometimes the ultrasound misleads you a little bit, you know. I mean, part of it too is just your pelvic area is small, you know, and pelvic area with guys that have a little bit of belly, that makes it hard, just even with the robot to get everything down there. So sometimes just a big prostate, small working space, it all kind of goes together and makes it difficult.
Do you just kind of spot check to see if everything else looks okay while you're in there?
Or? Yeah, and we also kind of go based off of how the tissue separates and things like that. All your tissue planes were good and stuff, so I wasn't really worried about it being spread. It was just sort of a tricky thing to work around in your anatomy, and obviously the cancer was contained, so that kind of jives with all that.
Phew. Yeah, I think I made the right decision then.
Yeah, I think so. We'll just keep an eye on the PSA. So we'll get this out today, start doing your exercises. 3 months, we'll circle back, get your first PSA, and go from there.
Okay, so I'll need to make an appointment for 3 months?
Yep. I'll put the PSA order in, just get it a few days ahead of time, and then we'll have that to review.
Okay.
So if you got any problems in between now and then, let me know.
Yeah. Well, I took a lap around the block when I got home one day.
Yeah.
And my granddaughter wanted to go out and walk, and of course I wasn't very fast. And then Saturday we did another walk, and I did 3 laps.
Good.
And about halfway through the last lap, I'm like, okay, this is the last lap.
Yeah.
And then I had nice pink lemonade in the bag.
Right.
It cleared right up. And I only had like 2 or 3 clots I noticed, so I don't think I've had really any problem. Just
bowel movement wise been okay?
Finally. Oh yeah. That was I've been farting like crazy, which I guess is normal. And one night this shoulder felt like I had an ice pick in it.
Mm-hmm. That's from the gas.
Yeah, I know. I'm like, oh my gosh. And it was just unreal, but I haven't had it again. So
you eat okay? Yeah.
I can't believe how hungry I get.
Right.
I am just amazed.
Oh, yeah. Good.
I'm like, oh, food. Oh, I need more. You know, It's just like that. I even gained a pound. I'm like, I don't need to do that direction. You know.
Yeah. Well, I think you're doing great. Just keep going. You know, let me know if you have any issues in between now and then. But that, I know it kind of looks gnarly right now, but it looks pretty normal for this. The bruising and stuff.
Doesn't appear to be infected.
Don't see anything.
Okay, excellent. So I just need to keep an eye on it and keep dry dressing changes, and eventually they'll finally decide to dry up. Okay.
Correct. Yep, it will.
All right.
Okay.
Well, I think that's all I had. So thank you very much.
Yeah, you're welcome. We're around if you need us, but she'll come in and get this out.
Right.
You're out of here.
Okay.
Just stop up front. They'll get you that appointment, okay?
All right, awesome. Thank you very much.
Cool. Good to see you.
Good to see you.
All right, have a good rest of the summer.
Thanks.
However long it is, I guess.
Well, it started to get real cold at night, I tell you that. Yeah. Typical
rough.
Michigan, right?
Yeah. All right, good to see you.
Good to see you.
Thank you all very much for joining me today. I hope you found this informative and helpful. If you have a prostate, be sure you're getting it checked, especially if you're over 50 or have a family history of prostate cancer. Please be sure your doctor is including a PSA test as part of your blood work with your annual physical. That's how I caught mine and was able to act before it had spread. So please encourage the men in your life and others with prostates to keep an eye on their PSA.